Soweto is South Africa's most populous township and home to millions of eyes. St. John's Eye Clinic is part of the massive Chris Hani Baragwanath Hospital, also known as Bara, and is the biggest eye hospital in the southern hemisphere. Many of Soweto's poor and indigent utilize the services on offer here.
We serve a huge population here of the greater Soweto. It's probably at least 2.5 million. We don't know the exact numbers. And we're known as the Eye Hospital. We've been here since 1955. And we're part of Bara, and we have a good reputation. We have a lot of social violence, motor vehicle accidents, and then also gunshot injuries that come to us. And our main function was to do cataract surgery here. We are overwhelmed on a daily basis by all the trauma that we get.
Dealing with the repercussions of Soweto's social problems on top of their regular work places added pressure on St. John's limited resources.
Generally, patients who come here, they can expect to wait most of the day for the service to happen. That's because we're overcrowded and we just aren't able to give them a specific appointment time because we just don't have the ability to do that.
Dr. Rob Daniel is a few weeks away from completing his 5-year residency at St. John's. He will be moving into private practice.
This is the screening clinic, the function of which is to filter out who needs to be seen today and really to pick out the most urgent problems and really to treat small problems that can be sorted out in a short period of time.
On a typical day, Rob can see between 200 and 300 patients.
The numbers of patients, we regard more as a privilege rather than a frustration because of the huge experience that comes with it. Frustrations, this is Africa, there's always shortage. Equipment is always a problem. Most of us have our own equipment just to get through. Diabetics, we check the same day because if there's any problem, then we want to be able to just pick it up right away. Oh, you've got a date for today. You can go to the main clinic. You've got a file, that's right. Just come. Main clinic. People with trauma, we'll see them the same day. We organize a card for them and then they're seen in the main clinic down at the bottom. Shift up, sis.
Patients are referred from the screening room to the main clinic. They can wait most of the day in the queue.
Every day we've got our patients that come and see us here on the, what we call the benches. Last time you had this test was in June. Yes.
Looks fantastic, okay.
A repeat patient, 43-year-old Paul, is led into the clinic by his friend. Paul's blindness was caused by untreated diabetes. His wife couldn't accompany him, as she is the family's only breadwinner. She supports Paul and their 4 children.
He's a friend in need. Before I was blind, he used to help me a lot. But now I think he's worse than before, because now I see these things are peeling off from his eye.
It's making the pain, it's making the eye painful every time.
He developed a corneal ulcer in his right eye, so we've been treating that, essentially trying to make him comfortable. It's more for pain. It's like we're not trying to get any visual improvement, because obviously we can't. But unfortunately, he's taken a turn for the worse.
Dory calls Dr. Hemant Khanna, a senior doctor, to get a second opinion on Paul's case.
And it's a big perf. It's huge.
It's huge, so we're not
the
going
lens is coming out. It's got contents extruding.
I just thought it's a blind eye anyway, so
we have to remove it.
That now that the eye is open, that eye is going to become very painful. And so the best option for you really is to have an operation where we remove the eye. Okay, understand?
Yes.
So what we're going to do is
Paul's eye will be removed by Dory tomorrow. He is referred to the surgery booking office.
O tlo sign-a gore wa e dumela operation akere? You are signing gore wa dumela? Akere ga re go fostele tla a tlisa
I
letsogo
posted.
wena la go painela akere? Okay. Yaka o etsa na o sign-a gore re tsa visceral akere?
Hemond is one of the clinic's consultants. He's been at St. John's for 6 years.
Eye doctors have to have reasonable eyesight. You can't do ophthalmology if you've got poor vision. Because whatever we do, we're using our eyes to see the pathology in the eye to make the diagnosis. We see more and more of diabetes now. It can cause blindness in a variety of ways. Cataracts occur earlier in diabetic patients. They do get damage to their blood vessels. Sometimes they develop new blood vessels which grow at the back of the eye, which bleed, and they can get hemorrhages. That's what Mr. Morabe has had. He's had new blood vessels growing in, abnormal blood vessels which were leaking and bleeding. And that's why he's had a huge bleed, and that bleed created a cloud that he couldn't see through. That's why he had the surgery done yesterday. So we have to draw the retinas. So the next time this patient comes, if somebody else sees him, at least he knows what we've seen at the last visit.
Okay, thank you very much.
Okay, thank you, Phil. Thanks. Okay.
Back from the screening room, Rob continues checking on patients. A man comes in complaining of poor vision.
We deal with people in terms of their life. Your vision is the most important sense which you have. To not have that is so debilitating. How old are your glasses, bro?
It's the old one.
How old are they?
It's long time.
Long time.
The new one is broken.
New ones are broken. Oh, okay, well, if you go back to your old glasses, obviously they're not going to be set up for the new lens that we put inside your eye. So that could well be the reason why he's not seeing well in the distance. But at least we looked for a reason and we found one. Go, Mama.
Rob next sees a 75-year-old woman who presents with cataracts. A simple operation will restore her sight, but there is a 2-year waiting list at St. John's.
Okay, sit agtertoe. Cataracts are really related to age. 60% of 60-year-olds, 70% of 70-year-olds, and so on. Ouma kort na operasie. Dan is daai jong manne in groot gevaar weer.
You can doctor also.
Come sit there, Gog. Big smiles. Right. Did they put drops in your eyes? Well, there's the old saying that the eye is the window to the soul. We doctors, and we deal with people on a very personal basis, which is fundamentally based on trust. The comfort which a patient feels by us caring for them. That's what gives us a lot of our job satisfaction. Right, that's it. Another day in paradise. Go with this doctor. He's going to give you a date.
Yep, back on the bench.
For some doctors, it's another day seeing patients on the benches, while for Hemond, it's a pediatric clinic, which brings its own particular challenges.
What's wrong? Hello? Yeah. What do we got for you? Let's see. Kids are kids. They don't like to be touched. So you got to try to catch them when they're awake and when they're playful. You want some sweets? Oh. So you just got to be patient with them. In the very youngest kids, we use things like hundreds and thousands just to get an estimate of what their vision's like. Yeah, here we go. What's that? You see that? Give you some lights. Yeah. Yeah. Well, you can see me. 80% of all sensory input comes from your eyes. So the way you view the world, perceive the world, comes from your eyes, basically. Obviously, these are kids that are growing up. Some of them you can do something about. Some of them you can't do anything about, like the developmental problems, you know. When you are walking around the room, he follows you.
The boy probably has a neurological disorder.
He follows you.
He will be referred to Bara for further tests.
But like now, you know, showing him the small sweets. He can't see that, you know. So he looks like he can see large objects, but he can't see the smaller ones, you know. Okay. And the eyes are apart and they're bigger than normal. So we think baby's got some sort of a syndrome, you know.
Today is Paul's surgery. Dory will be removing his eye and inserting a silicone ball into the empty socket to stop the pain the ulcer in his blind eye is causing him.
Duck.
Sorry, Paul, and it's going to sting.
Sorry?
Sorry, this is painful.
Because of his blindness, Paul has never seen his young son.
I'm missing my son. The last one, I don't know him. I don't know him. He's about 10 months now. Because I'm getting him while I'm already blind.
Going to be doing what's called an evisceration. Basically remove the cornea and then put in a silicone ball to give some volume to the orbit and close it all up. And the eye is blind, so we've opted to give him a final solution and do the evisceration. Right now I'm just cutting away the conjunctiva. The work we do here and the things we see here, probably the only place in the world you'll ever get this exposed to so many different conditions. Right, so that's our silicone ball. We've put the silicone ball in now, and now we're just going to close up. We're going to close the sclera and then the conjunctiva, and then we're done. Everything went well, there were no problems, no complications. We did a successful evisceration, and he should be fine. Probably should go home tomorrow.